Well, good morning and welcome to the Osher Center for Integrative Medicine Grand Rounds Lecture Series. My name is Peter Wayne and I serve as the director for the Osher Center, which is jointly based at Brigham and Women's Hospital and Harvard Medical School. Today we have the privilege of learning from Dr. JoJo Kwok, who'll be presenting to us all the way from Hong Kong on her rich research related to mind-body practices and Parkinson's disease. But before introducing Dr. Kwok, I have a couple practical announcements. First, if you wish to receive CMEs for today's lecture, just take a second to copy the information from this slide and follow the instructions. It's pretty straightforward. And second, as you listen to Dr. Kwok's presentation, we encourage you to write questions for her using the Q&A feature. Dr. Ye, Gloria Ye, will be collating these questions and will present them to Dr. Kwok as she facilitates this discussion at the end of her talk. And I just wanted to give you a heads up in case some of you leave the event a little early, but we'll have Dr. Howie Sesso presenting. He's one of our research directors at Osher on nutritional supplements and well-being. And just note that the week is the second week of March, not typically the first week for this event. So now it's my sincere pleasure and honor to introduce today's distinguished speaker and my friend and colleague, Dr. JoJo Kwok. Dr. Kwok's an assistant professor at the School of Nursing and the associate director at the Center of Behavioral Health at the University of Hong Kong. She's a registered nurse and a certified yoga instructor in Hong Kong, and she holds nursing, MPH, and PhD degrees from the Chinese University of Hong Kong. Dr. Kwok's research centers around neurology care, behavioral science, and rehabilitation medicine, focusing on nurse-led, compassionate-based care models for movement disorders. Her pioneering research has been published in top-ranked journals such as JAMA Neurology and Parkinson's Disease, and she was listed in the top 2% of the world's most cited scientists in 2023 by Stanford University. This is a remarkable achievement for an early-stage investigator. In recognition of her research achievements and contributions to the nursing profession, Dr. Kwok was recognized just this past year in Washington, D.C. as a Fellow of the American Academy of Nursing in 2024, perhaps one of its youngest inductees. And in 2023, she received the Emerging Nurse Research Scholar Award from the Honor Society of Nursing. Dr. Kwok serves as a council member and Education Training Committee member of the Hong Kong Parkinson's Disease Foundation, contributing to Parkinson's disease-specific programs for patients, caregivers, and healthcare professionals. Given my own interests in mind-body research and Parkinson's disease, I've followed Dr. Kwok's research carefully over the years. And when I received a note from her a few years back saying she wished to do a sabbatical here at our Osher Center, I jumped at the opportunity. It's been a real pleasure for my team and I to get to know Dr. Kwok more personally and professionally, and we're excited about the new areas of research that we're pursuing collaboratively. The title of Dr. Kwok's talk today is Integrating Whole Person Care, a mindfulness-based model for Parkinson's disease and caregiving. So without further ado, please join me in welcoming Dr. Kwok. I'm going to stop sharing my slides and invite her to share hers.
Thank you. Thank you. Good morning. That's my daughter. Good morning, Peter, Gloria, and fellow Osher colleagues and friends. And thank you for the kind introduction. It's my great pleasure and honor to share my work on whole person mindfulness-based care for Parkinson's disease and caregiving with you all. I look forward to discussing this further with you at the end of the presentation. And before we begin, I would like to declare that I have no conflict of interest related to the presentation content. When we talk about Parkinson's disease, we often picture someone who is stiff, has a tremor, or walk unsteadily. Indeed, patients with Parkinson's experience various motor symptoms, bradykinesia, masked face, focal symptoms, rigidity, tremor, walking difficulty, dystonia. But they also face many non-motor symptoms, including neuropsychiatric problems, cognitive impairment, autonomic dysfunctions, sleep disturbance, and informal caregivers, particularly the spouse and family members, provide most of the care, and they experience high level of stress. Beyond the visible motor and non-motor symptoms, living with Parkinson's disease involves struggling with those invisible psychosocial and spiritual consequences. Parkinson's care is a lifelong journey. When does it begin? How is it diagnosed? What is the prognosis and what treatments are available? And how do response fluctuation occur and manage? These are all the questions that weigh heavily on patients and caregivers alike. But can these questions be addressed solely through a pharmacological approach? It's not possible, right? We need a whole person health approach that considers the emotional, psychological, and social and spiritual dimension of care. And this comprehensive perspective is essential for truly supporting individuals to live well with the disease. And this disease is incurable. Between 40 to 50% of PD patients experience stress-related neuropsychiatric symptoms, and stress can worsen many motor symptoms, including tremor, freezing of gait, bradykinesia, dyskinesia. While improved mood is linked to better medication responses and enhanced motor performance, the question remains, how can we maintain an optimal state of arousal, one that is socially engaged, feeling safe, calm, grounded, open, compassionate, and being present? As a behavioral researcher and yoga practitioner passionate about mindfulness and compassionate care, my work focuses on mindfulness-based model of care. Mindfulness involves paying attention in a particular way, on purpose, in the present moment, non-judgmentally, with curiosity and kindness to the things as they are. Mindfulness teaches us how to remain resilient in the face of adversity. This Chinese means the present and with a heart. So, how can our mind anchor in the present moment? For someone living with Parkinson's disease, struggling with physical symptoms can make it challenging to directly encourage mindfulness practice. Patients with Parkinson's disease, they experience a lot of physical symptoms. It's a movement disorder. They're concerned about the movement, right? They might not feel that they need the psychological care, or they just lack of the awareness of the benefit of psychological needs or care. Therefore, we first repackage mindfulness as a psychologically informed physical therapy through mindfulness yoga practice. What comes to your mind when we talk about yoga? Do you think of very strong asana and difficult posture? And can patients with Parkinson's disease practice yoga? Here is our mindfulness yoga for Parkinson's disease program, which focuses on 3 key components: breathing technique, pranayama, posture, asana, and meditation. We use a gentle and stepwise approach to cultivate awareness, to unite the body, mind, and spirit, to promote self-realization and mental detachment to overcome the spiritual ignorance. It's a skill to help patients to achieve self-transcendence, to show greater acceptance, to reach out to relate to others, to integrate their past and future to make sense of the present moment. And finally, to enhance and cultivate spiritual consciousness. We first compare mindfulness yoga with conventional stretching and resistance training exercise for patients with mild to moderate Parkinson's disease. Our first trial was published in JAMA Neurology in 2019. In this RCT, mindfulness yoga demonstrates significant improvement in psychospiritual outcomes, including anxiety, depressive symptoms, perceived hardship, and perceived equanimity. While both groups, yoga and stretching, experience enhancement in motor symptoms, only the yoga group report an improved quality of life. This reflects how mood and awareness, mindful awareness, can facilitate the illness perception, adjustment, and overall wellness. Psychological care should be emphasized in Parkinson's disease clinical pathway. And then we have some other question about how different mindfulness techniques affect stress and inflammation markers for patients with Parkinson's disease. In 2020, we secured a general research fund to study mindfulness in stillness and mindfulness in motion, a RCT on the effect and acceptability of individual mindfulness technique, meditation, and yoga on anxiety and depression in patients with Parkinson's. The manuscript has been recently accepted by the psychotherapy and psychosomatics undergoing editing procedure and will be published soon. In this trial, we aim to find out, are meditation and yoga effective psychological strategy for reducing anxiety, depression, and chronic inflammation in patients with mild to moderate Parkinson's disease? We randomized 159 participants to meditation, yoga, and usual care. This table presents the co-primary outcomes for anxiety and depressive symptoms. At the 2-month assessment time point, meditation significantly reduced both anxiety and depressive symptoms, while yoga significantly reduced anxiety compared to usual care. And this slide outlines all the measured outcomes. Compared to usual care, both meditation and yoga significantly improve anxiety, motor symptoms, quality of life, describing facets of mindfulness. And we also note delayed improvements in serum interleukin-6 and inflammation marker. Additionally, meditation results in a significant reduction in immediate depressive symptoms and sustained improvement in motor symptoms and quality of life. We also conduct subgroup analysis. We find that those at risk of depression experience greater benefits from meditation rather than yoga, including more substantial reduction in depressive symptoms, improved quality of life, mindfulness attributes including describing, non-judging, and non-reacting. And depressed individuals might respond better to mindfulness in stillness, the meditation techniques. And in our previous qualitative exploration of patients' experience with mindfulness yoga practice, many of them report that mindful walking helped to alleviate their freezing of gait symptoms. And this prompted us to formulate a new research question. What are the effects of a home-based exercise program that integrate mindfulness and yoga on balance and mobility? We have recently completed the recruitment for this fund project, and now we are collecting the last round of data. Before that, we first conducted a network meta-analysis, and in this network meta-analysis, we found that high-complexity motor training combined with attentional and cognitive strategy might be promising in addressing freezing of gait symptoms. And notably, stress and cognitive impairment are modifiable factors associating with freezing of gait, and mindfulness might be helpful. So we have modified our mindfulness yoga intervention to focus on mindful walking and developed the MyPace program. Mindfulness yoga practice awareness through cognitive-based exercise, which is delivered through Zoom. We aim to examine its effect on functional mobility as the primary outcome compared to usual care. Additionally, we assess its effect on freezing of gait severity, balance confidence, motor symptoms, anxiety, depressive symptoms, mindfulness, and quality of life. When someone experiences a sudden onset of freezing of gait, their thought often breaks, "Oh my God, it's happening again. I can't do it," leading to anxiety, stress, along with an impulse to unfreeze quickly, which can result in falling. And this response disappoint themselves, further intensify their anxiety and emotional distress. And that's why we teach mindful walking as a way to reboot their response, promoting more intentional and safer outcomes. For the assessment, we leveraged the Mindful app to evaluate the time up and go test under different experimental conditions, including dual task counting, narrow passage, and normal walking. This approach helped generate more detailed and convenient lab quality data related to time up and go tests, and we have a rich dataset available. And if you are interested, please feel free to reach out to me for further discussion and potential collaboration. And the previous project focused solely on the patients, right? While emerging evidence has highlighted the importance of dietetic science, as well as the role of gut-brain axis in PD prognosis. Our earlier survey found that poor patient-caregiver relationships significantly correlate with increased caregiver burden and poor quality of life. This prompted us to consider adopting a dietetic approach to study the gut-brain effect of mindfulness practice. And we are grateful that our proposal has been funded last year and the project has recently started. In this project, we will explore the effects of dietetic mindfulness intervention and their mutual influence on biopsychosocial outcomes, including the gut microbiome within the diets of patients and their caregivers. We will employ an actor-partner interdependence model to guide our analysis. We published a review on microbiome-based intervention for neurodegenerative disease. Most of these microbiome-modulated interventions focused on probiotics, fecal microbiota transplantation, dietary and exercise interventions, which look into the motor or the gastrointestinal symptoms, and relatively less attention has been given to investigate the psychosocial effect of psychological mind-body intervention. And that's what I'm interested in. So what is the effect of mindfulness on gut-brain axis? Our team has pilot tested the feasibility of microbiome analysis using 57 samples collected from our previous mindfulness project. Preliminary analysis has identified two potential functional pathways mediating the effect of mindfulness: a higher baseline abundance of Faecalibacterium cross and increased GABA synthesis, both associated with calming and sleep-promoting effects. And we are currently preparing the manuscript and hope to share more details soon. And another part of my research, let's move to the self-care for caregivers. I'm incredibly grateful to have received a fellowship that enabled me to collaborate with Peter, Gloria, and Ivy at Osher. Caregivers often prioritize the need of their care recipients over their own self-care needs. And a lack of non-judgmental awareness of body sensation and emotional clarity can lead to misinterpretation of physical activity-associated physiological response. For example, exercise fatigue and exhaustion. Also, maladaptive physical activity behavior like avoidance, withdrawal, and low compliance. And in this funded project, we aim to develop and examine the feasibility of a brief and blend mindfulness-based lifestyle counseling program, Be Mindful Life, to facilitate behavioral risk modification among caregivers of people with neurodegenerative disorders. Here is the Liverpool mindfulness model for lifestyle modification. Through mindfulness training, we aim to enhance caregiver non-judgmental awareness and their willingness to experience negative sensations related to physical activity, like fatigue, caregiving burden, I don't have time, and self-limiting judgment, I can never be active again. This approach is intended to motivate them to remain physically active. The primary outcome is the objective measurement of time spent on moderate to vigorous physical activity, MVPA, using a smartwatch gamut. And the secondary outcomes include self-report physical activity, self-care behaviors, self-care advocacy, perceived stress, anxiety, depression, and quality of life. And mindfulness and brain activity levels are measured as mediating variables to better understand the mechanism underlying the intervention. We also assess patient outcomes such as the perceived social support and quality of life. In this pilot trial, we compare Be Mindful Life to general education. Be Mindful Life include an in-person 3-hour mindfulness-based lifestyle counseling workshop, a personalized 8-week instant message delivery intervention, chat-based support using motivational interviewing technique, and also a smart variable, the Garmin. The control group will receive an in-person 3-hour general health education workshop with reminder message for follow-ups and also a smart watch, the same smart watch. So I would like to share a bit regarding the development of this Be Mindful Life intervention, the message library development. The message library is underpinned by 3 frameworks, including the integrated body-mind-spirit framework, the process model of lifestyle behavioral change, and the behavior change techniques from the BCT taxonomy. The integrative body-mind-spirit model emphasizes a holistic approach to clients' care, rooted in Yin-Yang, Taoism, and Buddhist philosophies. Our 8-week messaging theme aligns with the IBMS component, integrating physical, mental, spiritual well-being to promote a balanced and mindful lifestyles for caregivers. The process model of lifestyle behavioral change provides a structured framework for facilitating lifestyle change through increasing motivation, promoting action plans, and maintaining behavioral change. In the message content library, each message aligns with a component of this model to ensure the adherence and strengthen the content quality to promote sustainable lifestyle change. We also adopt the BCT taxonomy to guide our content development. BCT taxonomy summarized 93 techniques in 16 clusters, providing a structural approach for promoting behavioral change. You can access the BCT taxonomy through this link and this reference, which details these techniques. Using this taxonomy ensure our content is grounded in evidence-based behavioral practice. And here is an example of our regular test message, which aligns with the BCT code, including instruction on how to perform the behavior and provides prompts or cues to encourage the action. So our theme for the first week is being present. Remember what the instructor shared in the workshop? And I would like to invite you to gently close your eyes and observe your feelings of this particular moment. Choose a word. It doesn't matter what you are feeling. Right now, there's no need to change them. Just allow and accept them. Find a safe and comfortable space and listen to the body scan audio, etc. with the reply button so that we can know the participant response, whether they read the message or not. We also develop various multimedia resources to support the mindfulness and exercise practice, including the graphic, audios, and videos. From our first cohort, most participants expressed satisfaction with the regular message delivery. Additionally, all participants found that the chat-based support to be helpful. During our 8-week intervention, we observed strong engagement levels, with participants responding to 33 to 40 of the 40 regular messages sent, and additionally, they used chat support for 12 to 18 days, sending a total of 50 to 56 text messages. And this data underscore the active engagement of our participants throughout the intervention. In our chat-based support, participants engage in a variety of topics, including mindfulness-related inquiry about what is mindfulness, what are non-judgmental attitudes and challenges that they face during the practice. They also discuss physical activity about the discrepancy between average daily step and MVPA, exploring modifications to exercise routines considering body limitations such as the pre-existing knee pain. And additionally, they discuss about the technical questions such as the function of the Garmin watch. One participant asked, "You often mention non-judgmental. Could you explain that?" And other participants share challenges, such as distraction from thought and heightened awareness of discomfort. They said, "During meditation, I got distracted by thoughts on regulating the mind and emotions. My watch vibrated, and I noticed sensation in my feet and an ache in my left foot. I also thought about my back pain from sitting too long. This focus on bodily sensation heightened my awareness of my discomfort." And another participant mentioned, "I'm trying to walk enough to hit the 10,000 steps in the next couple of days, but my active time has been 0. Why is that?" And other participants share, "I tried the exercise from the link you provide, and they were great, especially the seated option for those with disability. I will do my best to find time for myself and boost my confidence. With all the great resources, I'm excited to follow along." Preliminarily, the effect size for total MVPA is 0.4, and that for the 10-minute bout of MVPA is 0.7. So here is another example for another collaborative project on upscaling psychosocial intervention for loneliness. We investigate whether telephone-based behavioral activation and mindfulness intervention delivered by older laypersons are superior to telephone-based befriending in reducing loneliness among low-income older adults during the COVID pandemic. We randomized over 1,000 lonely, digitally excluded, low-income older adults who lived alone. These 4-week layperson delivered telephone-based intervention significantly reduced UCLA and Dijon loneliness scale score for the behavioral activation and mindfulness intervention compared to the befriending intervention at 3 months post-intervention. These results suggest that older layperson delivered telephone-based structured psychosocial interventions, especially behavioral activation and mindfulness, are effective, safe, and accessible option for addressing loneliness in at-risk older adults. This is another collaborative project that I would like to share with you. We adopt the multi-phase optimization strategy to examine a multimodal dementia caregiver support intervention. We investigate which psychosocial intervention, including self-care, behavioral problem management, behavioral activation, mindfulness, or support group, are the most effective and interact within a multimodal support intervention for dementia caregivers. In this fractional factorial clinical trial, we randomized 250 caregivers with depressive symptoms or caregiving burden to 16 experimental conditions. All of them received the core component of psychoeducation, and there are 5 task components as mentioned before. Mindfulness components significantly reduce depressive symptoms and improve social support at 12 months. The support group components significantly improve perceived social support at 12 months, while the behavioral problem management component had mixed effect. That is, it initially increased the caregiver anxiety at 6 months, but improved psychological well-being at 12 months. Interaction effects were observed for components, including self-care, behavioral problem management, mindfulness, and support groups. Look at these figures. Mindfulness components enhance the benefits of self-care and behavioral problem management component on depression. And meanwhile, the mindfulness component and support group component synergetically improve anxiety and social support. And the manuscript has been accepted and will be published soon. And these findings suggest that integrating mindfulness with support group or behavioral management components could serve as an efficient and effective multi-component approach to enhance the psychosocial well-being for caregivers for people with dementia. And to conclude, our research aligns with the National Center for Complementary and Integrative Health Research Framework and adopt a whole person health approach. We investigate the mechanism of mindfulness-based intervention using comprehensive biopsychosocial spiritual measurements, including the biomarker objective measurement like interleukin-6, cortisol, TNF-alpha, and gut microbiome. And we refine and optimize the intervention delivery modality, such as in-person, Zoom, individual, diet, professional, and layperson, different kind of delivery for modalities. And we are very grateful to receive a 1.6 million donation from the Hong Kong Jockey Club Charity Trust to launch a territory-wide implementation project, namely the Jockey Club Moving Care for Parkinson's Disease project, which aims to establish a comprehensive and sustainable community care model for those affected by Parkinson's disease. The project promotes early awareness, diagnosis, rehabilitation, and mind-body wellness, while focusing on community engagement to raise the public awareness of Parkinson's disease. The key components of this project include early symptoms recognition and risk assessment, mind-body interventions for at-risk individuals and diagnosed patients, patient peer support training, and training in compassion-based mind-body modalities for caregiver, for allied health professionals, community actors, and volunteers. We have also developed different advertorials to promote the public awareness and foster a Parkinson's disease-friendly community. May I take a moment to share our recent anti-stigmatization video with you? As I'm from Hong Kong, I would like to take this opportunity to introduce Cantonese to you. And we also provide English subtitles for better understanding.
話我冇事停，成隻兔仔咁，但我爸爸呢就成日慢吞吞。
慢慢嚟，
我都唔知點解嘅。快啲啦，快啲啦，有巴士啦！
慢慢嚟。
點解嘅？
慢慢嚟啦。
點解嘅？
多謝姐啊！
媽咪啊，點解爸爸咁論盡，你都中意佢嘅？
因為爸爸最溫柔、最堅強，同埋對我最好咯。以前係，而家都係。
做咩啊？
冇嘢啊，爸爸水啊！
So, last but not least, I must express my gratitude for the support of my clinical and community partners, including the Hong Kong Parkinson's Disease Foundation, the Hong Kong Parkinson's Disease Association, and the Hong Kong Society for Rehabilitation, as well as the Osher Center, Peter and Gloria, Ivy. I also want to acknowledge my dedicated research team, Vicky, a research assistant professor, Melody, a postdoc fellow, Yuki, a dietitian and senior research assistant, Karis and Michael, research assistant with psychology backgrounds, research nurse Erin and Jeremy, and my PhD and MPhil students, Lily, Wilfred, and Christine. Without their efforts, none of this would be possible. And let's stay in touch and connect with me on LinkedIn at JoJo Kwok. I will be visiting Boston in late March and October this year. So any questions are welcome, and I already saw a few pop up in the chat box, and I look forward to more international collaboration and synergy to contribute to the science and also the art of integrative health and medicine. Thank you.
Thank you so much, JoJo. My goodness, that was a whirlwind, and you cover so much and across that spectrum of the NIH, the NCCIH's, kind of progression of the research trajectory, from basic science sort of questions all the way up to implementation. So it's really remarkable the amount of work that you've done, in your career thus far. So I really just applaud you and thank you for sharing all of that with us. So just for the audience members, I'm tag teaming with Dr. Wayne today. So he did the introduction of JoJo. So I'm going to be doing some of the Q&A together with Dr. Kwok. So I'm Dr. Gloria Ye. I'm the Director of Clinical Research at the Osher Center. Okay, so there are some questions that have come through. And as I was thinking, during your presentation, I had some questions that also dovetailed with some of these. So let me try to maybe synthesize a little bit, and then we can also go through and just go through the questions one by one. But I saw one question that was, asking about the physical effects of the meditation. And at the same time, I was thinking about, because you're looking at both the mindfulness in stillness and the mindfulness in motion, right? And so thinking about that differential between, the mindful movement versus seated meditation, because I think that you had one of those studies that where you found, I think that the mindfulness was actually better than the movement for the depressive symptoms, right? And so I guess thinking about about the stillness versus the motion versus the motor symptoms versus the non-motor symptoms and more the psychological, what have you learned from all of these studies, and sort of, put that together? In my mind, I feel like, oh, well, the mindful movement, has both pieces. So, you get both but, it's most likely, more nuanced than that. So just would love to hear your thoughts about that.
Yeah, thank you, Gloria, for the question. And in fact, that's the question that was motivate me to conduct this study. As a yoga practitioner, so it's like for me, I thought mindfulness emotion may promote more benefit, but the study result turned out is different. And so we look into the qualitative data and we find that for patient, and especially for more depressed or distressed patients, it would be difficult for them to follow the movement. Maybe because their symptoms, it is a little bit like distressing. And when the mindfulness technique is combined or is delivered through physical movement, they will think it's very difficult to like really experience the mindfulness, or they really struggle with the movement, and then they neglect the mind-body connection. They could not cultivate the mindful attitude of how to respond that with like openness or kindness. So that's an aspect that we could further explore, I would say. And for participants, distressed participants from the meditation group, it seems that the more statics or mental practice, the mental training, they could follow better. Yeah, so from the findings, we found that the distressed participant respond better to mindfulness in stillness, But we also need to consider the engagement. We also compare the satisfaction, engagement, and the class attendance. It is slightly, the yoga group show higher engagement and higher class attendance. So it's always a mix, and I would say it's good to start the mindfulness practice maybe through stillness approach. And then when they master the skills, perhaps we could further enhance with movement approach.
Yeah, interesting. That's what I was thinking. It sounds like you were saying that we should start with stillness, mindfulness and stillness, and then move on. So then I'm wondering, well, you did say, certain subgroups, I guess, if people have predominant Parkinson's with predominant certain symptoms, is one better than the other to start with?
Yeah.
What about in the caregivers? Yeah.
Yeah.
Do you feel like that also goes for the caregivers as well? Is sort of that thinking as well, or
I think the opposite.
okay,
I
yeah.
still stick with the yoga approach. And maybe for caregivers, they like physically should be relatively fit, although they are older adult. But sometimes it's like difficult to motivate them to like really just practice mindful breathing, to practice mindful meditation, because they will feel that's very static, right? And that's why we got the Be Mindful Life intervention. Yeah. So we encourage them to like to motivate them to engage in a more physically active lifestyle, but also with mindfulness-based approach for self-care.
Yeah. So I was really it's complicated. These are these multi-component interventions, right? They have so many different potential active ingredients, and depending on how you put them together, and depending on how you deliver, and depending on who's the receiving target population, this all may change. And so I love that you're doing the most study, that factorial design study where you're basically allowing you to sort of maybe tease out some of these components and what their individual effects are, and in certain combinations. And so I think that's one really strategic way that we can go forward and do this work to try to better understand all these components. All right. So I had this. There was another question about adherence in the chat, and I think the question from the audience member was, considering the age demographics, was anything done to support non-adherence? Any metrics on non-adherence in the interventions? And I think within that question is something about like the uptake of these types of interventions in this older population, potentially the movement, potentially the virtual piece of it, or some of the mobile, the phone, the technology, that aspect of it, together with the Garmin, the smartwatch, all of those stuff. What was that uptake like, and anything specific that was needed to be done for adherence?
Yeah, so for the adherence, I assume it's related to the Be Mindful Life intervention. So the one with caregivers, and then we use the Be Mindful Life, the chat messaging, and also the smartwatch, the trial. So we only conduct the first batch of cohort, and from our experience, we got one drop out. But that drop out is because of open abdominal surgery. We not relate to the intervention itself. And for all the participants that joined the first batch of cohort, they really adhere to the response. And I think it's important for EMI, like for this kind of like messaging intervention, we need to record the response. When we send out the message, we always have a reply button. And then the participant can have positive, neutral, or negative response. For example, they could say, "I'm ready to try. I will do it," or "I'm not ready," or I have question. So when they click "I'm ready," and then we know at least they read the message and they somehow maybe engage to the practice. And for those participants, they not respond to the message, we will have the track-based support and we will do the weekly follow-up to have some probes to see their engagement. And for those who click, they are not ready. It's a good opportunities for us to take this opportunity to further intervene through the track-based support. So I think in this kind of like hybrid intervention design delivered through messaging, the interaction is important. Yeah, we cannot just, we receive many spam message and emails every day and we never click in, right? So it's important to really record their response and then intervene and have real time or like real person interaction. When they feel the care, they are more willing to talk to you, to talk to us about their struggle. And it's not easy when we talk about mindfulness, right? It seems it's an easy statement, but when we need to integrate in our daily life, it's not easy. It's a lifelong journey. So it's a good way to like using these telephone or like messaging approach to upscale the intervention, to standardize the intervention, to make it more accessible for more people. Yeah. I would say the track-based support is important, and from the participant interaction, they think the track-based support is helpful. Yeah.
I think it's always helpful to have that personal touch, to actually interacting with, thinking like there's another person that cares for me on the other end that's helping me through this journey. So I just wanted to say, I think as I'm rereading that question that the audience member might have been asking about not the caregivers, but the actual Parkinson's patients, thinking maybe like an older population. So in terms of adherence metrics or anything that was done to help the adoption of interventions in the Parkinson's patients.
Yeah, so our participant, or let's say patient with Parkinson's disease, usually around like 60 or 70. So majority of our participant, I think the mean age is about 65 or something. They do engage and the oldest participant, as per my memory, is about 80 something. Yeah. So when we are delivering the mindfulness intervention or the mindful yoga intervention, we always start with a choice. So participant can have their own choice, modification of each pose. Because individual with Parkinson's disease, no matter they are young or old, they experience motor fluctuation. Their symptoms can vary days to days. So today they might seem fit or nothing. The medication response is good. They are recharged, but somehow they may experience off or the motor fluctuation suddenly come. So it's important to cultivate the mindful awareness, and we use a lot of verbal cues to cultivate. In Cantonese is 松容,寬容,笑容, which means be lenient to yourself. 松容,寬容, be acceptance and to smile. Yeah, something like that. And most of the participants really appreciate this type of like culturally sensitive and relevant encouragement cues. And the atmosphere is important. When they are in a group practice, the instructor, whether the instructor can be a good role model and really can cultivate an accepting or like a mindful environment for them to experience is also important. But for our yoga practice, we always have modification for them. So they can, if you are good today, you can do the more challenging one. If you feel less well today, take it easy. It's always okay. If you cannot do it, we will also mention it during the class. If you cannot do it, you can think about it. When you think about it, you did it. Something like that.
Yeah, yeah. So the intention is important there. And yeah, we always, that's the beauty of some of this work is that it is very modifiable and can fit the population. And so I think that that's, key to that uptake and adherence. So a couple of interesting questions that are bringing in AI in the chat. So, one of the questions is broader. So any efforts in the area of AI and technology being used to fast forward the research. And then another person was wondering, I think, whether the chat-based support that you use was actually AI or not. And so let me talk a little bit about AI and whether you've used any in these studies.
Yeah, so it's really important question. One of our intention to deliver or to develop this intervention is we try to collect a rich data set of the messages and interaction to train an AI for the future, for the next project. And with the AI technology and development, I think it's highly feasible. And in our like chat-based support, sometimes I do encourage our team members to try to first draft your response, and then you ask the AI to use motivational interview to draft and respond on behalf of you, and then cross-check. So I think this is a convenient way, right? Yeah. But
Yeah, so it sounds like it was not AI chat. It was actually a person on the other end, but they could utilize the AI tools to maybe enhance or optimize, their response before they respond. But that in the future, you could potentially use all of these conversations that you've collected to actually train AI so that in the future it might be more autonomous. Is that what you're saying?
So
Yeah, that's so interesting. We're really at this frontier, of new technology, new tools. There's probably ways that we're not even thinking about now that we could use in the future.
I think we need to embrace AI, but I do think the human touch and interaction is irreplaceable. Yeah.
Yeah, in so many things, I think, in so many parts of our life. Okay, let me see. I think there was, we have a few more minutes. After mindfulness and the yoga intervention, any assessment of change in medication utilization?
Yeah, so we record the medications usage for each assessment time point. And we also adjust it using the levodopa equivalent dose. And for we also conduct sensitivity analysis, excluding those with levodopa change or medication change, and the result is consistent. So like the paper is going to be published soon, and you can have a more detailed look into our data. Yeah, thank you. Thank you for the question.
Another question here is, please comment on any known trainings for yoga professionals for Parkinson's disease and dementia populations.
Yeah, it's a very relevant question, and that's why in 2022 we collaborate with the Center of Behavioral Health, and we adopt a trainer approach and launch 200 hours Yoga Alliance accredited mindfulness yoga teacher training for allied health professionals and educators in Hong Kong. Yeah, so I would say it's a very broad contest for like yoga because yoga is we got different style, we got different approach, and so what is mindfulness and how mindfulness could be instilled in yoga as a therapy. So we still have a lot to work on, I would say. Yeah. But we are doing it and we hope we could do it together.
So any known trainings for practitioners in the US?
A lot.
Yoga?
Yeah. I think in the because Yoga Alliance like based in US and there are a lot of like they might not frame they are mindfulness yoga, but mindfulness is the core of yoga, right? Yeah, but it's somehow when we are living in the commercialized world, like most of the yoga studio, they might focus more on the physical aspect, on the physical fitness and beauty, but relatively less attention has been given to the meditation, to the breathing, to the spiritual aspect, to the ethical yamas and niyamas of yoga practice. Yeah.
Wonderful. Okay. I see we're coming to the top of the hour. But I just saw one other question that I would love to ask before we sort of the last one is that how do you think these findings compare to what has been seen in Tai Chi studies?
Yeah. Last summer I joined the contemplatory the conference and I followed Peter's training on Tai Chi, and I'm not a Tai Chi expert, I would say, but it's really interesting for me because they share a lot of like Qi, the mindful flow, and I am really interested to like maybe in our next project we can compare it.
Yeah. So it's interesting because there's been quite a bit of work, in terms of research for using Tai Chi and Parkinson's, and I also, I think what you're saying, and I also believe that, at the core, these are, this mindful movement, mind-body movement, whatever you want to call it, mindfulness, in motion, therapies that really share these um, core aspects, core principles, the mindfulness, meditative aspect, some breathing and then some movement. And honestly, if you're doing, some more simplified yoga, or you're doing Tai Chi or, even Qigong, kind of warm ups, many times it looks very, very similar, right? And so, some of the specific postures or movements, may be a little bit different. But at the end of the day, I think there's probably more in common than different. And so I see like this body of literature being, sort of one, really, really, really informing on similar things. So yeah, I appreciate that question as well. So
Thank you.
I think we're at the top of the hour. I think I got most of the questions here. Um, oh, well, let me see if I can ask this last one really, really quickly. So Dr. An, from our group asked that or said that this is really amazing work. You've done so much. For those of us pursuing multidimensional whole person research, how are you able to do the work in such a comprehensive way? Looking at symptoms, caregiver dynamic, microbiome, messaging. What insights can you give us about how to do this in an effective way? So just your last
Okay.
thoughts, sort of
So
last suggestion to us.
yeah, I think that's the beauty of mindfulness is to train you to be a resilient researcher and go with the flow. And when you are passionate about something, I think you just follow your passion and try to like there are a lot of work that we could further explore regarding the mind-body modality. And for me, it seems like a mission is to like because for most of the behavioral intervention, people would comment is not hard science, right? It's relatively soft or less compelling. And I do hope by integrating more comprehensive objective outcome and with a whole person health approach, we could together like contribute to the field of behavioral science and mind body, because it's just beautiful. Yeah.
So with that, I just want to thank you again for this wonderful discussion and conversation and your wonderful presentation. It's really an amazing body of work that you've done. So thank you so much, JoJo.
Thank you.
So I'm
Thank
just,
you.
and I'm just going to take one last minute and just do some of our outro informational, let me see, give some information here. Oh, sorry. Here we go. Okay. So I think Dr. Wayne did share. Let's see. At the beginning, so our next month's grand rounds will be on nutritional supplements and well-being outcomes, and this is our very own Dr. Howard Sesso from the Osher Center, who's our director of nutrition and supplements research. And again, this is going to be not on the first Tuesday, but the second Tuesday of the month. And then very briefly to thank you all for your support and to invite you, if you're able and willing to help us support our programming here at the Osher Center and make a donation. We have so many wonderful programs that we try to bring to everyone that spans, our integrative medicine grand rounds. This seminar right here, our network forum that was just on the intersection of technology, our mind body movement programs, as well as planetary health in our clinical center. So thank you all very much. Again, thank you, JoJo, for a wonderful morning, and happy Chinese New Year. All right. And with that, thank you all, and have a wonderful day.
Thank you.